If you're joining us from home, you're tuning in to a live stream discussion with myself, Sandeep Prasad. I'm the Executive Director of Action Canada for Sexual Health and Rights. And I am joined today by a very special guest, Laski, who is the Chief of the Sexual and Reproductive Health Branch in the Technical Division of the United Nations Population Fund. Welcome, Laura.
Thank you for the invitation. I'm very happy to be here.
Well, we're very thrilled that you could join us tonight,
and
that you could participate in our various events this week. Let me first start by saying a bit about Action Canada, and then maybe we'll have a bit of a conversation around some of UNFPA's work.
Great idea.
Okay. So Action Canada for Sexual Health and Rights is a new organization in that it's just over a year old now, but it was formed from three organizations getting together in an organizational amalgamation, and those three organizations were Action Canada for Population and Development, the Canadian Federation for Sexual Health, and Canadians for Choice. So three organizations with three very long and very rich organizational histories, so I like to call us the elderly baby. But we've had quite a busy year focusing on domestic Canadian sexual and reproductive health and rights, as well as global sexual and reproductive health and rights issues. And we are, of course, UNFPA's implementing partner in Canada, and we're very proud to have that relationship with UNFPA. And tonight, as you all at home will likely know, is actually the eve of a very important day here in Canada, in that it's the first speech from the throne of this new government that we've recently elected here. And during the election period, we saw both opposition parties, the Liberals and the New Democratic Party, critique the previous government's record on sexual and reproductive health and rights, and both of them promised very explicitly to do better. Now, after the election, we've seen the Liberal government, Prime Minister Trudeau, send out mandate letters, and for the first time, publicize those letters, signaling an era of transparency that is refreshing and very good to see. But more than that, in the actual letters themselves, there were very clear promises on some sexual and reproductive health and rights issues, and to fix the record of the previous government with this new government. So for tomorrow, our expectations are quite high. We need to see real movement behind these electoral commitments. We need to see a strong re-engagement with civil society here in Canada. And we need to see an approach that centers sexual and reproductive health and rights comprehensively and rooted in evidence within Canada's global affairs. So that's the context of our talk tonight. And again, we're so pleased to have Laura with us. And you've had a busy day of meetings here with Government of Canada representatives and talking about UNFPA's work. I'm wondering if you wanted to say a bit about UNFPA's priorities currently.
Well, yeah. So thank you. Yeah, thank you for that introduction, which is very. I think this is a great time in Canada. I'm very enthusiastic. People are very happy about what is going on here, about the commitments of the government, at least during the campaign, and now we are seeing that there is an interest in sexual and reproductive health. And I have had this meeting today with government officials from Global Affairs Canada, and that's the new name. And we feel that I'm very happy and positive about Canada going to the world and supporting sexual and reproductive health and rights. What are our priorities? Today is also an important day for UNFPA. We just launched all over the world this report, which is the report of the State of the World Population Report. It's our flagship report. And it is about women's health and what happens with women and adolescents, in particular adolescent health during humanitarian situations. It is very interesting because it calls the attention. I think the picture says it all. It calls attention of how much harder it is for women in humanitarian situations on the run, in which they have to deal obviously with the family and the children, but also they have to deal with themselves when they are pregnant or they are subject to sexual violence, as they are always are. Women are used as a weapon of war in general when there are violence, and so this is an important report that put this issue in the global, the issue of the needs that women have in terms of sexual and reproductive health and rights when they are on the run and when they are looking for shelter. So that's a good and important day for us. We have seen monitoring the tweeting, and we see that it has been an amazing success, the launching of this report, which in Canada will be launched in March. I'm sorry to say that, but I think it comes with a great prize, because our executive director is going to be launching this, and so this is fantastic that he's going to visit Canada for, with this, for the first time with this government. So that's
Absolutely,
great.
and that we are tremendously excited about that. Those of you at home will no doubt recall that we've actually postponed the Canadian launch of the State of World Population Report until early 2016, and as Laura is now mentioning, we will be launching it here in Canada with UNFPA's Executive Director, Dr. Babatunde Sotomayor, who will be making his first official visit to Canada under this new government that we have. So we are tremendously excited that will happen.
Yeah. Exactly, and you asked me about what are the priorities of UNFPA, and that is one of the priorities. But another one, and there has been, governments have agreed on a plan for sustainable development. And so what will be UNFPA contribution to that is very much part of the discussions we are having right now. And yes, at the center, sexual and reproductive health will be there, but also adolescents and youth. Because we believe that there is the opportunity now. The Sustainable Development Goals plan that the governments have agreed in September includes, it's very comprehensive, it's very ambitious, it's very also complex, but it's centered on people. It has a focus on several sectors. Compared to the Millennium Development Goals plans that we had in the 15 years before, the Millennium Development Goals were focusing on specific issues and very much vertical approaches to those specific issues and diseases. Here we have a more comprehensive one. And so there is a challenge to, on the one hand, do this comprehensive approach, or there are many competing issues, but at the same time, maybe if we focus in one population group, I'm not saying that it's the only one, but it's a very strategic one. If we focus on adolescents, for example, a generation that grows up with with values, embracing values of human rights, embracing values of gender equality, and getting a comprehensive sexuality education, making sure that they are part of the, since we have done a lot of good job in terms of achieving universal education, primary education, why not focusing now on making sure that this generation, what now people are starting to call the SDG generation, the Sustainable Development Goal generation, can benefit from staying in school, but also, benefit also from sexual and reproductive health, from these values of gender equality and human rights. Other issues as well, like for example, this time of the life of a person is an important time for preventing specific issues like non-communicable diseases, because at this time is when young people start smoking or they start to form their own behaviors. The formative years that could have a big impact on the life after and on their own life in particular if we make sure that they participate, they are empowered, they are part of this new generation that will grew up with this new value.
Absolutely.
So that's what we are doing now, thinking how to focus on the agenda, how UNFPA will contribute to the agenda of the sustainable development.
Well, that's a really important priority. For those of you just joining us, I'm Sandeep Prasad, the Executive Director of Action Canada for Sexual Health and Rights, and if you've missed the early part of this conversation, I'm joined by Laura Laski, who is the Chief of the Sexual and Reproductive Health Branch at the United Nations Population Fund. And Laura's been now talking to us about some of UNFPA's priorities, particularly as they relate to the new Sustainable Development Goals that the United Nations have now agreed upon at the high-level summit this past September. And now all eyes are turned on how those goals are going to be implemented. And Laura's been talking about the importance of prioritization of adolescents and young people in the implementation of that agenda. Now, Laura, maybe you could say a bit more about that, because I know that within the SDGs there was a push to have a goal on adolescents and young people, and yet that didn't come to fruition. So given that, is there a risk that adolescents, and particularly adolescents' sexual and reproductive health needs, simply because of some governments choose to see adolescent sexual activity as controversial, is there a risk that those needs and priorities will be left behind in the implementation of this new agenda? How do we, as a community, prioritize that?
Yeah, I think it's a good question because it's not mentioned specifically. Only there are places in some of the targets. As you know, the Sustainable Development Goals are 17 goals and 169 targets. So it's a big agenda. So how do you visualize and not only visualize but make sure that the group adolescents are really seen as a group for where you could do investments. The countries have decided to go by sectors, and so that's why that goal did not pass, because it was a specific group of the population. However, you can make sure that in each sector a focus on this group is ensured. You have education, and what is the biggest, task that now we need to do in terms of education? Well, we have done a lot on universal primary education. What it comes next is the high school, the middle school, and we need to make sure that who are the population that is going to go through that period, are adolescents. So that's one. And we need to make sure that the issue of comprehensive sexuality education is part of the life, is being adolescent is becoming sexual. That means that there are many programs that will need to be supported for adolescents to be in a way in which they don't become vulnerable for their sexuality, but they become, their sexuality becomes something to be enjoyed and not to be a risk for them. Then you have the job, the employment for young people, and employment for young people is really identified in the targets.
That's true. Yeah.
Then you have health, and in the health goal, you have one related to sexual and reproductive health, universal access to sexual and reproductive health, services including family planning. There are two indicators that the government sort of seems that they are agreeing on. One is on family planning, but the other one is on adolescent birth rate. and there is the divided by ages between 10 and 14, meaning that the goal of the 10 to 14 is that we reach adolescent birth rate of 0 at that age, because we know very well that age when it's not that the adolescents are sexually active at that in that period of time. It's in general when they are pregnant or they get pregnant, it's because this is a result of violence, peer pressure, and sexual harassment, or because they are married and so forth. So that's another one that is very, very clear. There is one target on that, indicator on that. Another one, and this is a whole other topic, is the goal on gender equality. And there is where adolescents are an important role to play. We have one goal on child marriage, against child marriage. That's adolescents. Another one on female genital mutilation, and a lot has to do with that. Then you have another goal on reproductive health, but reproductive rights more than that. Then violence against women, in which the visualization of young people is there as well. So there is the task for us right now to take the different dimensions of the sustainable development goal and make this an agenda for adolescents and youth. How, we risk, in relation more to specifically to your question, is the mobilization of young people is going to be very important. But also the understanding of countries that maybe if they invest in these groups of the population, they have other benefits that are more economic and social benefits, that they may want, and even peace benefits that they want to use. It's what the plan of the society needs to plan now. It's obvious that it needs to be on that group, because the other group, of course, we have even made a lot of progress in the child survival. A lot of progress. So now this is the group that is next.
It feels like that argument around investment is always a very crucial one for governments, right? They want to see return on their dollars spent. And I think that those arguments will be perhaps even more needed with this agenda, simply because it's quite a broad agenda, as you said, the number of goals and targets, 17 goals, 169 targets. It's quite a rich agenda with a lot of issues in there. Where do you think things are at in terms of financing that agenda? How would you describe what's needed now, and what would you say could and should be Canada's contribution to that agenda?
Yeah, well, there are two. I see where you are going, but let me tell you first that it's important also that to recognize that there has been a conference, Financing for Development, in Addis, and there is an Addis plan of action that goes hand in hand with the Sustainable Development Goals agenda, and there is a strong call to make sure that the countries mobilize domestic resources. And even in the countries that don't have all the resources, they have a choice on where those funds should be invested. However, there are countries in which their own budget is not enough, will not cover the needs of the population, particularly those who are more vulnerable, those who are the poorest of the poor. And the agenda, the 2030, which is the Sustainable Development Goal, is strong on the inequalities part. And so, because it is strong on the inequalities one, there are donors that will continue to put funds. We expect countries like Canada to increase their funds to specific issues. Obviously, Canada cannot fund the world on their needs on the Agenda 2030. Canada could select very strategic investments that could help move this agenda forward. And in my view, this issue of adolescence is one, the sexual and reproductive health is one. But there are countries. There are some countries that would benefit from increased investments by developed countries. It's interesting because the agenda is universal now. It's not just about the developing countries. Now it's everybody has agreed on this agenda. So it would be good to see what Canada will do for Canada as well.
How very true, and we're all eagerly waiting to see how that might evolve. Well, over to you who are watching this broadcast. We want to hear your questions. We want to respond to your questions. And I know that my colleague has just brought me the first question that we received online from a viewer. What steps will Canada have to take to implement Agenda 2030 in Canada and globally? Concretely, what are those steps? And of course, we've just been talking about that.
Yeah. I think that I have been discussing this today with people from the government about whether there is some positions that Canada is taking about Agenda 2030, and I think this is part of the discussions they are having and getting prepared. Many of the partners I know are taking some time to really digest the Agenda 2020 and discuss where strategically they will put their focus on. I'm sure with a new government in Canada, they will also have the time and take the time to do that, although it is very urgent because the countries are now planning their own the Sustainable Development Goals in their own countries. Some countries have started to do that. So maybe that we arrive a little bit late, so it will be good to have position papers and discussions internally. In terms of what Canada, the steps Canada could do in the country itself, for us it will be great, and this is an idea that we have, if in some aspects, as we talked, the agenda is very broad of the 2030 agenda, but in some aspects, Canada is able to show what they have achieved in some of the targets so far, and if they can be twinned with countries in the south, for example, so that they could have learning experiences about how Canada have done this aspect of the Agenda 2030, and the countries in the south can, share their own experience, so that there is a sort of learning space for the countries to see how they are going to move on this and monitoring this, having good interlocutors about that, and based on concrete experience in some countries. In many countries of the world, this is not new, the sexual and reproductive health, for example, and every country has something to share, including the countries of the north, for which we never had the opportunity to learn from, at least the countries from the south, because we were not working with the countries. So it's a good opportunity to learn. The steps are first knowing what are the priorities. I think that's the first one. The first step, no?
I fully agree. I mean, I think there's a lot of sharing of experiences that can be done, but also a recognition that that this is a universal agenda. And there's also, as you say, there's a lot of improvement that needs to happen in every country of the world. If we look across a broad agenda, there are lots of areas in every country within that agenda that requires focused attention and efforts. Within the Agenda 2030 framework, there is an expectation of national action plans that are to be developed at the national level. And I mean, for Action Canada's sake, we are hoping that we can see some movement on the part of government domestically and working, of course, across federal, provincial and territorial governments to generate a Canada-wide plan of action to implement the SDGs. I think that's a crucial first step. And part of that plan of action really needs to deal with monitoring and accountability of implementation. I mean, this has been such an agenda that is focused on the importance of accountability, and accountability has been a very strong and heated discussion within those intergovernmental negotiations. We really need to see critical parts of that plan of action include what Canada's going to do on a regular basis in Canada, dialoguing with the people of Canada to evaluate jointly as a country where we are in implementing the Sustainable Development Goals. And for our sake also, we want to see regional and global leadership from Canada in championing accountability. We know that several other regional blocks within the UN system, for example, in Africa, there's the African Peer Review Mechanism, which will be seized upon for monitoring the implementation of the SDGs. You know, there's the Asia Pacific Forum on Sustainable Development that's also being developed under the Economic and Social Commission of Asia and the Pacific. Canada is part of the Economic Commission for Europe, and within the ECE, I think we would love to see movement towards the development of a peer review mechanism at that level. I mean, do you think that's something that's actually feasible, Laura?
Peer review. It's interesting. Two things. One is that we don't have the accountability agenda yet, because
that's true.
It's been still negotiated, and a lot of discussions are still going on. And these, at least the indicators will be approved and negotiated by the countries in March at the UN Commission on Statistics. So we will see a lot of discussion going on there. Maybe I know that the technical people are working on these indicators, but sometimes there is no agreement among the technicians and the politicians, and so there may be some discussions yet to go. This peer review is very interesting. You know, I don't know if you know, but within these Sustainable Development Goals, the Secretary General has launched this global strategy on women and children, and now they have added adolescent health. That agenda, which Canada has supported a lot, and now has very clearly sexual and reproductive health included there, but many other issues as well. It's very interesting because countries have made commitments to this agenda. There are, at the moment, 44 countries, but this is going to be launched at the World Health Assembly in May. And we're trying to make sure that other countries, as they plan for the SDGs, they also make commitments to the Every Woman, Every Child, Every Adolescent initiative. What I want to tell you is that this group will create an independent review group. And that independent review group, the Secretary General has just opened a public request for nominations for people who will be part of this reviewing these commitments that the country will do. This is a good, good progress, because it's a global independent review group in a way. So that's one example. Canada could take the lead and do it independently as well.
Yeah. I think, for from Action Canada's perspective, we've been pushing over the last few months this notion of trying to get Canada in its global affairs to move out of the siloed approaches it's taken to sexual and reproductive health and rights issues. We've seen some leadership on LGBT issues, for example, under the last government. We saw some leadership on certain aspects of maternal health, again, some leadership on certain aspects of child early and forced marriage. a lot of it has been biased with particular manifestations around selectivity, around what issues will be supported and what will be excluded from various initiatives. And we all remember that abortion has been excluded from Canadian foreign assistance for a number of years at this point. And there has been an under-emphasis on the delivery of contraceptive services within Canadian overseas spending. So we are really wanting to see, instead of more of these silos or more work in these silos, Canada stepping back now and taking a more comprehensive approach to sexual and reproductive health and rights. These issues are fundamentally linked in the right of every one of us to have full control over our sexuality, our gender, our reproduction, to have bodily autonomy and self-determination. And we really see that as a unifying perspective around which the new government could build a comprehensive sexual and reproductive health and rights policy to govern its global affairs. For Action Canada, I think that would be a really meaningful first step in implementing Agenda 2030 globally for Canada. Do you have any reflections on that?
Well, I think it would be welcome if the government of Canada is able to come back as a supporter of sexual and reproductive health and rights, a supporter of family planning. I think they have not had any, they have not really played in that space for many, many years. And so it would be good that they recognize the needs that people have in this area. And as they have been champions in maternal health, that they can also incorporate this contraception for different groups of the population that are in need of that, but also other issues, not just that. The agenda and the services of sexual and reproductive health for adolescent comprehensive sexuality education. So that as we make sure that adolescents stay in school, the comprehensive sexuality education is part of what Canada also supports. The leadership that they have had on child marriage has been very important and is really welcome, and we are beneficiaries of that. And I think extending that role in supporting those programs, particularly the ones for empowering adolescent girls at specific ages, so that the prevention of child marriage comes before they are married and not after, so that we have to put medicines to sort of protect that when adolescents are already having children, and this is very, very important. I think this government will do it.
Very keen to see that, and there's really promising signs, that's for sure. So for those of you who are just joining us now, I'm Sandeep Prasad, the Executive Director of Action Canada for Sexual Health and Rights, and I'm joined tonight by a very special guest, Laski, who is the Chief of the Sexual and Reproductive Health Branch for the United Nations Population Fund. And we have put out a request to all of you for questions for us to answer, and we'd love to have your questions, so please do send those to us. My colleague has just brought in another question for us, and we've touched on this already, but I think there's more to say. What do you see as the role of education in the development of sexual health and rights?
Well, as we have discussed, but maybe we can. I think that many of the issues that we have as bad sexual and reproductive health outcomes, and here I'm thinking about maternal mortality, going from the mortality to diseases to, other, to getting pregnant because you don't want to get pregnant, to maternal mortality, to sexually transmitted infection, etc., etc. those issues relating with the results of health services, education obviously is an excellent tool that we have to prepare children, to prepare adolescents who are in school and those who are not in school. There are many who are not, and so we need to make sure that they are part of also, they are benefiting from those. Education could help them to, as you were saying, perhaps take care of their autonomy, exercise their autonomy, make sure that women decide about their own bodies, men do that too, but their own bodies, not the bodies of others. And so if we, I believe and I learned that the education not necessarily is about how the body functions or how you protect yourself. Sometimes it's more important to learn about human rights, to learn about gender equality, values, to make sure, to learn about how to reach consensus with another person, to learn about resolving conflicts with another person that will help you in your sexuality, not only on that, but also in other aspects of life and social life. So education is fundamental, and also it will help you to get the skills to enter in the labor market, for example. That's very important. It's key. I don't know, what do you think?
We fully support that. I mean, I think when we talk about education, we also recognize the inherent right of everyone, especially children, adolescents, and young people, but also throughout the life course, of the importance of the right to education. And for us, when we speak about that right, we often talk about this notion of quality education. And for us, built in and inherent within that definition of quality education is the right to access comprehensive sexuality education, which for us is critical. So much so that Action Canada is in the process of producing guides for teachers in delivering sexuality education programs in schools, which will be available next summer, actually.
Well, is it for Canada?
It's for intended for Canadian schools, yes.
Oh, that's interesting. Well, we can have access to that so that we can see, because we also have these kind of tools. We follow the guidance that the UNESCO, UNAIDS and UNFPA have developed 4 years ago, but we don't have, sometimes we think the countries are developing their own guidance for teachers and do their own trainings, because it's very much contextual in a way, and we have their beliefs, etc. But I would be very curious to see your guidance on that.
Absolutely.
And see if we can use them for, make them available for countries.
I would be pleased to share that when it's published.
Yeah, I gather that there will be, the cultural realities are so diverse in the world that each country need to really look at their own ways of really discussing these issues. But I'm sure there is a way to discuss it in any society, but it would be good to look at, because Canada is a very diverse society. I'm sure you will take care of all that. So
definitely, that's something that's quite important to us. But even within that diversity, you referred to, there's certain key issues that I think need to be universally within these sorts of programs. And you mentioned human rights, issues of gender and gender equality, breaking down gender norms and stereotypes. Really looking at issues of sexual consent and helping adolescents build the skills to conduct sexual relations in a healthy and respectful way with one another. Those are all critical aspects, I think, of sexuality education curricula globally, even if the means to deliver that and the ways of talking about that need to be very
And
culturally specific.
I'm sure these are issues that is for the sexual relation, but for any other relation and any other interaction among humans, right? That you need to have. You have many cultural norms that you develop, but everything related to how you negotiate your life, it goes from the sexual life to everything, right? In the family, in the families, so many things.
No, I mean these issues of sexuality, reproduction, and gender relate to some of the most fundamental and life-changing decisions one can make, really, in such fundamental ways, and the fact that we overlook and deprioritize those aspects when we develop educational curricula is really
and the influences and the different powers that try to exercise and dominate, the different, if it is women or even men or boys or girls, what are the dynamics of these relations in which the sexuality is one of the very important relations in which there is a lot of domination, but this is also translated in the society, these relations and relations of power relations, but it's also so it's very important that we don't also talk in abstract humans, in abstract, because this is a society that have developed some kind of ways of dominating ones to and others, and this gender equality is one of the evidence. But there are many others, economically. So how, that's why it's so fundamental, comprehensive sexuality education is so fundamental to learn all those things in a way that will help you to deal with so many and understand the society as a whole and your own family, for example, to begin with.
Couldn't agree more. Absolutely. Well, we now seem to be flooded with questions. So let's see this next one. Yes, it is a good sign. The next question is: sexuality lasts a lifetime. Menopause is a huge problem for older women in sub-Saharan Africa, and it's totally ignored. What are your thoughts on this?
Well, this is a good question. I think that menopause is an issue for women all over the world, not just in sub-Saharan Africa. I don't know the reality in Canada, but in many of the countries that I travel to or I live in, it's silent. This issue of menopause is a silent issue. It's not talked in society because it is seen as that you have lost, what is value in a woman is her sexuality, her capacity to reproduce. And when the menopause arrives, that is a sign that this sexuality, as it is conceived in the society, and the capacity to reproduce is over. And so women are starting to did value at that age. You see that in the way, women of certain age after 50 are treated, So it is a silent issue, and many women have so many questions about it, and they learn in silence because they are not able to share their own feelings and their own physical feelings. But there is a lot of physical feelings on that. So it is a taboo in my view, and something that we need to really focus on. It's more related to sexual health than with reproduction, although there are a lot of issues that can related to the sexuality, the last years of the reproduction.
Well, The next question, I think, is for me. Canada plans to welcome 25,000 Syrian refugees. You've probably heard that news, which was certainly very welcome news. In the next 2 months, what will they need in terms of sexual health services? And has Canada planned anything yet as for these refugees?
It's a good question.
It's a very good question, yes.
Very good question.
Well, I mean, I think we've been very clear in wanting to see the implementation of what has been promised by the Prime Minister, the restoration of the interim federal health program for refugees and refugee claimants, needing to see that restored, because those needs, when those cuts were announced, have risen, and we've even within our own work at Action Canada, we operate an abortion information and referral line. We've seen calls from refugee women increase who are seeking services and having a tough time with the financial costs and bearing those out of pocket in this country. I think the removal of that coverage has really put their sexual and reproductive health, including in terms of labor and delivery, really at risk. So what we're wanting to see is a full restoration of that funding and the provision of pre- and postnatal and delivery care, contraception, cancer screenings, abortion services, and of course support in the case of intimate partner violence. Really being restored.
These are people who are coming to this country with very traumatic situations.
Yes.
And so I'm sure when they arrive here, they have a variety of needs. And so this is one, and the issue of violence against women. Maybe they have been subject to violence. We learned a lot that the refugees, girls, in the camps in Jordan, from Syria and in the camps in Lebanon, are being married off because it is for the families, given the burden they have in escaping and living as refugees in those places. They decide to do it. So that means that you're married. Maybe you will receive girls that are married. They are 14 years old and unmarried. And so what exactly do you do with that? That is an important dilemma that I'm sure that Canada will have to think about it. How to make sure that we provide services and we treat these refugees with all the rights that the Canadian citizens have when they live in this country. So and I'm sure they will need to get prepared, because you have been receiving refugees, but in such a number.
It's different, yeah. And
in such a number, I think it's something that you need to get prepared for and learn from countries. I don't think there is. All the countries, Germany, Sweden, are receiving this amount of people coming from this persecution kind of situation, which is very, very traumatic in many cases. And they will need many psychosocial support, but also the families may be the linkages between the family may be complicated.
Yes.
And given, when you have tried to survive after in this situation for a long time, and then you arrive to in a situation in which you live more in peace. There are many things that come out that you have to endure that may cause issues as well.
Yeah, definitely. And I think we'll be all ears tomorrow during the speech from the throne, because I think there may be some some further signals in that regard with respect to healthcare for refugees and refugee claimants.
Do they usually continue?
Yes, they will. In fact, right in our offices there will be a community-hosted viewing of the Speech from the Throne. And I think we're all looking forward to that.
Oh, it's very good.
So I think, I think we should recall also that just on this whole piece around refugee healthcare, that universality is not only a vital human rights principle, but it's also a principle of the Canada Health Act. And I think it's with that that the government needs to act. It seems like we're running short on time, Laura. In our 1 hour discussion, we have about 10 minutes left, is what I'm told.
Yes, I see. Yeah, I see the watch.
And we have one more question, actually. If you could summarize in 3 actions what the government should do, what would they be?
This government in Canada.
Yeah, if you have suggestions, and I'll also reflect on that as well.
Well, I think it would be very important that they really support several actors at the international level in the area of sexual and reproductive health and rights. It will be very important that the government of Canada, they have been that means that they will have to develop a policy, obviously, but support agencies like the United Nations Population Fund. And I'm saying this not because I'm from the UNFPA, but basically because it is very, very interesting that the government of a country like Canada have not supported contraceptives for a long time. And I think it's something of a right to have to decide first about your own number of children when your own population can do that. And why not support this in this area in which others should be able to do that? I think that Canada is ready for that. I think, in my view, having the government of Canada support in the discussions about how we're going to, what will be the accountability framework for the Sustainable Development Goals, to make sure that Canada is able to support good indicators to measure that, is going to be great. And if they become an advocate, a clear advocate for accountability and for measurements of accountability, that will really make sure that this agenda is not a disappointment in 15 years, but is really something that the governments of the world could be proud of, saying, yes, we did it. Or even if it is too ambitious, we did it, we are missing this part, but we move towards that. I think those 3 things are really.
That's wonderful. Actually, one of our viewers has snuck in a last-minute question for you. If I could just, before I respond to that last question, if I could just indulge the group with one final question for Laura. What is the relationship and attitude of UNFPA and G20 on sexual health and rights? So what is the relationship and attitude of UNFPA and the G20 on sexual health and rights?
The G20 just happened in Turkey, right?
Which probably is why the question's being asked.
Yes. Okay.
Yeah.
Okay, I just have to clarify that UNFPA works on sexual health, and unfortunately the UNFPA works on sexual and reproductive health and reproductive rights. We also support programs and services that do not discriminate anybody based on their gender, their age, their sex, like I said that, their education, their socioeconomic background, their their class, but they're also their race. So the governments, we follow what the governments have agreed for UNFPA to do. So if the governments when they agree that UNFPA mandate should include other issues, I think that we will be ready to do it. But at the moment, this is not part of the sexual rights, is not part of the mandate of UNFPA. We are doing sexual health, and we're working on preventing sustainable sexually transmitted infections. On the G20, I'm not sure what the governments have agreed in the latest G20, and if there is something specific, that's where the question is coming from. But if you do know, in Antalya or around the preparation for Antalya, there was some specific discussions about that. I don't know about it. But because the G20 are the countries who are the ones that are part of the G20 are countries that are in the process of advanced development compared to other developing countries. Some countries are very progressive. You have, now I understand where the question comes from. You have countries like Brazil, countries like South Africa, countries like India, but particularly Brazil and South Africa, they are very open to support sexual health and sexual rights. That's not my UNFPA position, this is a personal analysis that I'm making. Maybe this is India, is another story, but I think this is related to the question of Russia, I think, and the position that they may have. I don't think we have a position taken on that. Each country has the right to have their own, their own policies. Some countries discriminate, and we are not in agreement with that. But that's, we are supported by all the member states, so we don't take a position on that. But that's what I think.
You're a bit constrained on how you can speak out on these issues, even if you don't, as an agency, support those sorts of discriminatory
practices. I couldn't understand that question, but I think that question is related to the questions. But we support each country, and I'm sure in that country if there is discrimination, the people will stand up against that and will change that.
Yeah, that's great. Thank you, Laura. And let me just take a quick attempt to answer the last question, which was on what 3 points do we want to see the government prioritizing in the coming months. For that, in terms of Canada's global affairs, really that comes down to having a comprehensive human rights-based sexual and reproductive health and rights policy, which would govern its bilateral engagement, its multilateral engagement, and its development cooperation policy and practices. For us, that's fundamental, and I think with this new government and some of the signals that have come from them, we could see some real movement on that. Secondly, we want to see a very clear national plan of action that's developed in consultation with civil society and Indigenous peoples that really tackles and looks at implementation of the Sustainable Development Goals. Thirdly, we want to see some definitive actions on abortion access and comprehensive sexuality education access in Canada. I think there's a strong role for the federal government to play, leading negotiations and talks with the provinces on healthcare in pursuing a renewed federal, provincial, and territorial health accord. That's all the time that we have for tonight. I want to thank you, Laura, for being here with us. I want to thank all of you, our viewers, for tuning in, for your great questions. I want to emphasize that this video will actually be available on the Action Canada website, sexualhealthandrights.ca. And you can also go there to see a very comprehensive list of our policy proposals that we published a few months ago in the lead up to the election. And we are now seeking to have those policy proposals implemented by the new government. So I would encourage you to visit our website. Once again, thank you very much, Laura, and thank you to all for tuning in.
Thank you for having me, and I hope you are able to advocate for the policy changes you want to see.
Thank you. Thank you so much.